The country has in recent days been treated to fear-provoking images of individuals picking up used masks at a city health facility in an apparent plan to sell them to unsuspecting Kenyans. With Kenyans everywhere being required to wear masks in public places in order to prevent the spread of COVID-19, the big issue remains, how does one dispose of these masks? And amid public outcry over the obtaining situation, the government has moved to assure the public that it has put in place elaborate mechanisms to ensure that disposal of medical waste does not find its way back to the market.
40 million Kenyans every day having to put on masks like I am doing, and this is a single mask, a mask that I use it once a day. So I have to dispose this every day, and all of us have to do this. It is likely to become a serious problem if we don't manage this, because this is considered as hazardous, especially for some of us who may already be infected with the COVID.
Environment Principal Secretary Dr. Kiptoo saying that his department and that of health, with the support of the United Nations Development Program, have partnered to ensure the country's health facilities have sound waste management.
One of the components of that funding is on chemical and waste management, which is a project that we are partnering with the Ministry of Health. And so today we are here to hand over some of the equipment under that project.
We are part of this joint response, covering in its first instance efforts to contain the public health emergency under the leadership of the World Health Organization, because they are the specialist agency that is providing all of the protocols, and really Kenya is standing as a beacon of light in the region but globally in how it's looking to contain and flatten the curve.
Speaking during the handover of waste management equipment to the management of Mbagathi Hospital, Kiptoo revealed that his ministry has come up with a protocol on the proper disposal of medical masks.
Our ministry has issued regulations through NEMA, and those guidelines have been given to the Director of Public Health, and also the Ministry of Health has issued protocols on other guidelines on how to manage waste. So I think it is not now that there are no regulations or guidelines. The important thing is to make sure that those guidelines are followed to the latter. And I think what is important is public awareness, because all of us, whether we are at home, whether we are in the offices, in hospitals, we must make sure that we manage the waste and properly dispose. And we have to cover it in protective device, which is leak-proof, so that it doesn't leak in any way as you dispose.
What I want to assure the members of public is that we are going to put the best use of these machines and the equipment so that we get the intended objective. The intended objective is to try and upscale the services we are giving to our patients, especially this time of COVID-19 pandemic, and also protecting our staff and our patients. They will come in handy. And we are going to really make sure that we take maximum custodian of this equipment, and we follow the laid down protocols by the Minister of Health to achieve our objectives.
Similar waste management equipment will be distributed to 13 other facilities in 4 counties, namely Nairobi, Kisumu, Mombasa, and Nakuru. For Channel 1 News, I am Emily K. Bade.